You're then, with your clean hands, going to go and double glove again. And this time your outside gloves again are going to be the ultrasonic gloves, and the inside gloves will be the patient gloves. So we're going to do our layers in reverse this time. So now we're going to take some paper towels and put them in the bottom of the sink. This is not to serve as anything but a cushion for the appliance in case we drop it. We're just trying to make a safe landing spot that's a little softer, and we have to use disposable things. That's why we're using a paper towel. We're then going to have a patient bib. And that's going to be our landing spot, paper side up, for our clean appliance. We're going to have a clean zip top bag. And we're going to fill that zip top bag with a solution of 50% water and 50% mouthwash.
Should I use it?
Our cleaning solution doesn't taste very good, so anything that is a reasonable flavor is good. This is not functioning as anything other than keeping the denture moist and making it taste more pleasant after we have used the cleaning solution on it. And you just want enough in there so that when you put the water and solution together, that it's going to cover the denture completely. So that's all clean. We're going to put that clean bag standing on our towel. If you cuff the top of it, it helps stand up better. And we're going to try to keep that nice and wide open so we have an easy place to put those appliances. Okay, now we're going to take these gloves that we've kept very clean. Now we're going to use these clean gloves to go into the ultrasonic so that we don't contaminate the ultrasonic machine. And you're going to go into the bottom of the sink with these appliances because we really want to keep them safe. We're going to open the outside bag and really curl that down with a big cuff to completely expose the inner bag. So our concern is if somebody contaminated the ultrasonic, or if these bags had a giant failure and somebody's other patient's germs leaked into the ultrasonic, we want to make sure that we have eliminated that possibility of cross-contamination. So now these ultrasonic gloves are coming off and going in the trash. Again, just peel from the cuffs. And now we would have already set up a new denture brush for the patient. And we're going to take that denture brush and open it up and set it ready to be able to scrub. These can be challenging to get open. I like to keep the wrapping of the denture brush because if the patient likes this brand, I'm going to put this package in their oral hygiene materials so that they can go use that denture brush package to shop at the store and know that they're getting what they like. So now we have our patient gloves on. We're going to just touch the inner bag. We're going to open that nice and wide. And we're going to reach in and be able to get the patient's appliance. So we're going to be able to securely hold these. I usually take out one at a time so that I won't have an increased risk of dropping things. I'm going to take my denture brush, and you'll notice that there's a pointed side and a flat side. The flat side is going to be used on the outside of the denture in the area that looks like the gingiva and on the teeth. And then any place that's an indentation, we're going to use that pointed side. That's really going to access those ridge areas and allow you to really get that really adherent biofilm. You'll be amazed at how tough that plaque is. It's not even calculus yet, but it's still very difficult to remove. We're going to thoroughly clean that. We're going to have a little rinse with our water to be able to rinse off our cleaning solution entirely once we've scrubbed them up well. If we really want that not very tasty cleaning solution to come off. And then we would go ahead and place this into that good tasting solution that's going to keep it moist. It's going to make it pleasant for the patient to actually put in their mouth. We would then repeat that with the patient's other appliance if they have to. Same procedure. We would go ahead and scrub. We would go ahead and rinse. You'll notice on this partial where we're going to use that pointed brush, very, very important, is in those clasp areas. These clasps wrap against the teeth, and anytime you have that area that's hard to clean and that wraps against the teeth, if the patient doesn't get all the biofilm off of there, they're just replacing that nice mature biofilm in their mouth instead of getting a good clean start every time they clean their partial or denture. So we would give that the rinse. We're then going to put it into the patient's bag. So now, everything we have is now contaminated with the patient's germs, which is fine because that's where we're going. So again, we're going to seal that bag really carefully so that we don't have any spills or drops or accidents. Get as much of the air out, seal it really good. We're going to pick up the patient's denture brush and denture brush container, and we're going to go back to the patient. When we get to the patient, we're going to go ahead and educate them about how to clean their denture or their partial, and we're going to give them any products that we're going to recommend that they use at home for cleaning. Once you have educated the patient, we're going to take this, the appliances in the bag, and we're going to go find a clean area in the dental unit. Okay. Once you come back to the operatory, you're going to set the dentures or partials in a very safe place and one that is highly visible. Now, all we have is the patient's germs on this, so it can be on any surface that is has the patient's germs on it. It doesn't have to be pristine. It can have their bacteria on it. But we also definitely want to have this in a place that we can see very clearly so we don't forget to give them back their teeth at the end of the appointment. Mm-hmm. Once that is all done, we're going to package up the brush and the brush wrapper and any other items we gave them in education into their little goodie bag to take home so that they'll be well prepared to take care of themselves. So cleaning solution, denture paste, if we recommended any adhesive. Some patients need a new denture bath if their little plastic cup they use at home is old, and we would be able to give them a brand new one. Once you've dropped that off with the patient, we're going back to the OHC area. And the job's not done until everything is wiped. So now with these gloves, we can dump the solution down the sink. Don't throw it in the trash. Down the sink. Pick up all our disposables, bundle them up in our patient bib, and throw those in the trash. And then we're going to wipe down all the surfaces that we touched. So you're going to put on some clean gloves. You're going to come over and grab your cavity wipes. And as usual, this is going to be the double wipe down. Anything you touched, anything you might have splashed, the whole counter, the whole sink, and the handles of the faucet.